Are you dealing with complicated medical issues? How do you communicate with doctors and other providers? What are the best choices for treatment, care, and insurance? To what insurance coverage are you entitled? Are you frustrated by the healthcare system? Do you want to regain control of the challenges entailed in managing your healthcare? Hello, my name is Attorney Ramsey Bahrawy, and welcome to Your Money, Your Life. In this segment, my guest is Dianne Savastano, a registered nurse and the founder and president of Health Assist. Since 2004, Health Assist has been offering expert help in demystifying healthcare and the scope of your medical insurance coverage. It does this by providing customized services that help individuals and families navigate the complexities of the healthcare system. Dianne combines her experience as a registered nurse, a hospital administrator, an insurance executive, and also as a business manager consultant. This background uniquely qualifies her to understand healthcare from both clinical and insurance perspectives. She has appeared on NPR's Morning Edition and the PBS Second Opinion series. Dianne, welcome to Your Money, Your Life. It's great to have you on the program.
Thank you. It's a pleasure to be here.
If you go to a doctor's appointment with a patient and the doctor makes a specific treatment recommendation, do you discuss that with the patient? Do you perhaps discuss alternatives and that sort of thing? Is that part of the service that you offer?
It is. You know, when I go to a doctor's appointment with someone, we've created that agenda, and my goal is always for the individual that I'm consulting with to run their own meeting. So we try to think of all of the questions that we should ask, like alternative options for treatment. But I ask my client for permission ahead of time. If I think of something that you haven't thought of, is it okay for me to bring it up either in the middle of the meeting or at the end of the meeting so that I get all of my questions answered? And I'm trying to think of those questions while we're in front of the physician. And at the end, I like to summarize the meeting. So this is what went on in the meeting, and these are the action items. Are there any more questions? In the event, we go out and we debrief, and we usually do. Not only do we debrief verbally, but I usually do a written summary of that meeting. If there are additional questions, we can. I use all kinds of tools to get back to the physician to ask additional questions. But I am often talking through with the client what the treatment options are, what their preferences are. Sometimes I use different tools to help them even decide. I have one client, you know, who had prostate cancer, and alternative treatments were proposed to him. One was surgery and one was radiation treatment. Well, it was only through our discussion that he revealed to me that he had tremendous fear of being hospitalized in surgery because he had suffered a terrible staph infection many, many years ago. So when he superimposed his own preferences on the treatment options, he came to the conclusion that radiation was best for him.
Okay, well that makes perfect sense. So you're also taking into account how the patient feels.
Absolutely.
Okay, so you will discuss treatment recommendations and any alternatives to those recommendations. Now, you're not giving medical advice, though, are you? I mean, you're just having a discussion.
Exactly. I'm very clear that I'm not giving medical advice, and although I have a background as a nurse, it informs me, needless to say, so I have a lot of information as a result of that, and I do a lot of teaching. Once a nurse, always a nurse, and one of the primary responsibilities of a nurse is to teach, but I'm very clear with them that it's not my role to provide medical advice, but what I help do is identify if we need some medical advice, how we're going to get it.
Now, do you also discuss with your clients, the patients, how their insurance plays in the picture? You know, whether it's private insurance or whether it's public insurance, and what they can expect from their insurance coverage?
Absolutely. When I begin or initiate my conversation and or relationship with a client, I usually do a pretty comprehensive assessment. And one of the things that we talk about is what type of insurance coverage they have. And if possible, I do like to review the policy and or a summary of benefits. And I am including educational services with my clients. So I'm usually educating them about how their insurance works so that we live within the parameters of the guidelines that are there so that we don't run into problems down the line. In the event that we need to purchase different insurance policies, so say someone is now becoming eligible for Medicare, I'll help guide them through that process. If we run into an obstacle with an insurance company and we need to go through formal appeal processes, I'll guide them through that process. Because I have worked in an insurance company, I do have that sort of insider knowledge and information as to how that particular industry works. So that becomes a very important piece of management of people's care. It's unfortunate that sometimes the first question that's asked is what does your insurance cover, as opposed to what's the best treatment option.
Right.
So sometimes I'm trying to bridge that gap.
Okay. Interesting that they will ask the question that way. What does your insurance coverage cover? Okay, I'm going to share a little bit of a story with you, and I'm going to ask you what you would do as the advocate, as the patient advocate. Several years ago, I ruptured my Achilles tendon. And I had no family in the area. My parents were on vacation, and my siblings live elsewhere. And I went to the emergency. I did not know at the time I ruptured my Achilles tendon. I just had tremendous pain in my leg. Go to the emergency room. They did the X-ray. After the X-ray, the emergency room doctor came to me and said, "Would you like the good news or the bad news?" I said, "I'd like the good news." He said, "The good news, the Red Sox won tonight." I said, "Okay, what's the bad news?" He said, "Well, the bad news is you have a ruptured Achilles tendon. It's Labor Day holiday, and there are no doctors." I said, "So what happens?" He says, "We're going to cast it, and we're going to send you home, and when a surgeon can fit you in, we'll do the surgery." So I ended up having the surgery. My surgeon recommended that I stay in the hospital for 3 days. I'm single, I live alone, I have 13 stairs to climb upstairs. He didn't think it was a good idea to go home. I'm a member of a managed care insurance policy. My insurer turned around and said, "No, send him home." What would you have done in that situation?
Those are really tough situations because there are standards and protocols for how much time people should spend in the hospital for various types of injuries and or illnesses. It sounds like your surgery was an elective surgery in that you went home and then went back, right?
Well,
so it was planned?
I had to go home. I mean, I couldn't walk properly because the Achilles was ruptured.
Right.
So they put it in a cast, they sent me home, and then I came back and I had the surgery, repaired the Achilles. Obviously, I needed a day in the hospital just to come off the medication I was on, and then they felt I needed 2 more days of physical therapy before I could go home, and the insurer said no.
The reason I mentioned that it was elective is that it gave you a little bit of time to plan. And so if clients are actually having elective surgery, what I like to do is actually make contact with the case management department even before they go into the hospital, so that we understand exactly what that sort of general length of stay is and what that length of stay is that might be approved by the insurance company. And then we have to do some planning. Sometimes, sometimes you can get it extended for extenuating circumstances. The physician in the hospital has to substantiate to the insurance company why it is that you might need to stay a little bit longer. Sometimes that's not possible, so then we have to discuss the options. The options are that you stay there, but you pay privately. Other options might be that you go to a short-term rehab environment that your insurance company might pay for. Some people like to go directly home. Are there home-based services that we could have set up for you such that you would have some support at home that your insurance company would pay for? And sometimes there's not even that. So sometimes you have to either try to get some family members and or pay for services privately. So every discharge is complex, and I always tell clients that you should be planning for discharge. If it's an emergency admission, you should be planning for it the minute you get admitted, and if it's an elective admission, you should be planning for it even prior to getting admitted. But they're complex.
Okay, well, I'll give you the upshot of the story because there is a conclusion to the story. And I got on the phone myself to my own insurance company and I talked to them, and we ended up agreeing that I would go out of a semi-private room into another room where I was in with 3 people, and I would get to stay another day, and we'd take it on a day-by-day basis, and I ended up staying the 3 days, but I didn't get to stay in a semi-private room. So but you have to get on the phone and speak up for yourself.
Absolutely, and you have to know who to speak to.
Well, fortunately, the doctor basically told me, this is the guy I'm dealing with, this is the the guy you need to talk to. And I said, okay, fine. So I picked up my phone and I called him and I talked to him. And we went back and forth for a while before he finally said, okay. There was a middle ground. We were able to figure out a middle ground, and we negotiated, and we did it on a day-by-day basis. And by day 3, my physical therapist signed off and said, "You can go home now. You've learned how to use the crutches. You're walking. You're going up and down stairs. You're great. You're fine." I said, "Okay, thank you," and off I went.
Well, you know, that's a great example of relationship building, and that's one of the things I coach my clients about all the time. Sometimes they feel the insurer is a bit of the enemy, and I say, no, absolutely not. We need to develop relationships with either the claims representative or maybe the case management representative, and I often find them to be incredibly helpful. You develop relationships with the nursing staff, with the medical staff.
Right.
It's all about relationships.
No, you're absolutely right. It's a good place for us to stop.
Okay.
Without a doubt, communication is crucial to good health care. Becoming a better advocate for your own health and wellness pays dividends. However, to do that effectively requires both knowledge and preparation. Moreover, such a task can become overwhelming and even impossible, as one is bombarded with both complex medical and insurance information. This is especially true for a person suffering from the stress of an illness. Fortunately, there are companies with whom you can team up. These companies facilitate communication among all members of your healthcare team. They provide emotional and decision support, promote wellness, and empower patients in their quest to take control of their healthcare. One such company is Health Assist, which helps coordinate the details of doctor's visits, medication, and insurance coverage. Also, Health Assist oversees and works with in-home care providers and/or assisted living facilities. Transitioning from the hospital to a rehabilitation facility, Health Assist can help with that as well. Don't be frustrated, confused, or overwhelmed. Rather, regain control of your health care. A good place to start is by checking out the Services tab on the healthassistcorp.com website. In closing, thanks to my guest, Dianne Savastano of Health Assist. Dianne, thank you for appearing on the program.
You're very welcome.
And thank you to you, our viewers, for watching Your Money, Your Life. My name is Attorney Ramsey Bahrawy, Building Your Trust.